It is 2:17 in the morning, and the house is silent except for one sound. Lap, 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 lap. You find your dog over an almost empty bowl, water dripping from his chin, then hurrying to the back door. On the way, you step into a cold puddle, an accident from a doghouse trained for years. You filled that bowl before bed, and this is the third night in a row. You may blame warm air, salty food, or age, and sometimes the explanation is harmless. But persistent thirst can be an early clue involving the kidneys, blood sugar, hormones, urinary tract, liver, or reproductive system. And taking the water away can turn the body's compensation into a dangerous dehydration crisis. Hi everyone, I'm Dr. Ryan Scott, your neighborhood veterinarian. Increased drinking is often noticed late because water disappears quietly and early disease may look like extra trips to the bowl. We will cover the biology of thirst, 7 warning signs, the dangerous mistake owners make, a safe measuring method, tiered home support, and the line where veterinary care is non-negotiable. If calm, evidence-based pet guidance helps you, subscribe and stay with me. Let's begin with Chapter 1, Why a Dog Drinks. Your dog's brain, kidneys, hormones, and circulation operate like a tightly managed water budget. Tiny sensors respond when the blood becomes more concentrated or when effective circulating volume falls. The brain creates thirst, while a hormone called vasopressin, also known as antidiuretic hormone, tells healthy kidneys to conserve water by producing more concentrated urine. Imagine each kidney as a recycling plant with thousands of microscopic filtering units. Blood is filtered, useful substances are reclaimed, wastes are removed, and water is either returned to the body or released into the urine according to need. In many illnesses, drinking is the dog's attempt to replace water lost in urine. In diabetes mellitus, ineffective insulin lets blood glucose rise. Glucose then spills into urine and holds water there by osmotic force, producing more urine. Damaged kidneys may lose concentrating ability, so water escapes when the body needs to conserve it. Diabetes insipidus, which is not sugar diabetes, involves too little vasopressin action or poor kidney response to it. Cushing's syndrome, liver disease, high blood calcium, infections, and medicines including corticosteroids, diuretics, phenobarbital, or potassium bromide can also increase thirst. Thirst is a clue, not a diagnosis. Now let's move to Chapter 2 and the 7 warning signs. The first is more urine, especially large amounts of pale urine, bigger patches on grass, soaked pads, nighttime trips, or new accidents. True polyuria means a larger total volume. Repeated squatting with only drops instead suggests irritation or possible obstruction and may be more urgent. The second is weight loss, especially with a normal or increased appetite. In uncontrolled diabetes, calories leave in glucose-rich urine while tissues cannot use fuel normally, so fat and muscle are lost despite hunger. Kidney, liver, adrenal, intestinal, and cancer-related disease can also cause weight loss. Feel the ribs, spine, hips, and temples, and track weight on the same scale. A downward trend with thirst needs a veterinary appointment even if your dog still plays and eats. The third is appetite change, with nausea, vomiting, diarrhea, or unusually unpleasant breath. Kidney dysfunction can cause nausea as metabolic wastes accumulate, while Addison's disease, liver disease, infection, and other disorders can combine stomach signs with thirst. Repeated vomiting, refusal of food, black stool, bloody diarrhea, or inability to keep water down is not a watch-and-wait situation. Fluid loss can outrun drinking. The fourth is a new body pattern: panting at rest, a rounded abdomen, intense hunger, muscle weakness, thin skin, repeated skin infections, or symmetrical hair thinning. This cluster is associated with Cushing's syndrome, in which excessive cortisol affects metabolism, muscle, skin, and water regulation, but appearance cannot diagnose it. Take photographs and report every prescription, injection, ear or eye medication, and skin cream, because some contain corticosteroids. The fifth is weakness, trembling, stumbling, confusion, or collapse, which can appear when illness disrupts electrolytes, glucose, circulation, kidney function, or adrenal hormones. A tired dog should recover in a cool room and remain alert. Inability to stand, disorientation, seizure, collapse, or difficulty waking requires emergency assessment. Never pour water into a poorly responsive dog's mouth. Impaired swallowing can send fluid into the lungs. The sixth is urinary discomfort. Straining, crying, repeated squatting, licking, blood, a new odor, or only tiny drops. Infection can occur alone or with diabetes, Cushing syndrome, stones, or kidney disease. Odor and color cannot identify the cause, and clear urine does not prove healthy kidneys. A male dog repeatedly failing to pass urine may be obstructed. Rising pressure and electrolyte disturbance make this an emergency. The seventh applies to an unspayed female. Thirst with lethargy, poor appetite, vomiting, abdominal enlargement, feverish behavior, or vaginal discharge, especially after a heat cycle. Pyometra is a serious uterine infection. With a closed cervix, infected material is trapped, so there may be no discharge. A sick, thirsty, unspayed dog needs prompt care because pyometra can progress to sepsis, kidney injury, shock, and uterine rupture. Chapter 3 is your safe home assessment. Record when the change began and any change in heat, exercise, food moisture, medication, or dose. Then measure instead of guessing. For 24 hours, record exactly how much plain water enters the clean bowl. Measure what remains and subtract it, noting spills. If animals share bowls, provide a separate monitored bowl while preserving free access. Repeat on 2 or 3 ordinary days only if your dog is bright and comfortable. Divide milliliters consumed by body weight in kilograms. If a 10-kilogram dog drinks 1,000 milliliters, that is 100 milliliters per kilogram per day. Sustained intake above about that level is considered polydipsia, but a persistent change from your dog's baseline matters even below it. Food moisture, heat, exercise, lactation, and spills affect the number, so this is evidence, not a diagnosis. A cold nose, clear urine, or normal-looking gums cannot rule out diabetes or kidney disease. Early illness can coexist with a cheerful dog. Now Chapter 4. The dangerous common mistake. Owners ration water to stop accidents or attempt an internet water deprivation test. Do not do this. Drinking may be what maintains circulation while diseased kidneys lose water. Removing the bowl does not stop urine loss caused by glucose, poor concentration, or failed vasopressin action. It can cause dehydration, high blood sodium, neurologic injury, worsening kidney perfusion, collapse, and death. A veterinary water deprivation protocol, when appropriate, requires repeated checks of hydration, weight, urine concentration, and sometimes blood osmolality. The rule is clear. Never restrict water to investigate thirst, unless a veterinarian is directly supervising the diagnostic protocol. Chapter 5 is the safe alternative. Keep fresh water freely available. Block unsafe sources such as chemical-treated toilets, and turn the symptom into data. Use the same bowl and jug, start at the same time, record each refill, and measure the remainder exactly 24 hours later. Log appetite, weight, urination, accidents, vomiting, diarrhea, resting panting, and medications. Video unusual drinking, straining, weakness, or panting. This preserves the dog's compensation while giving your veterinarian a timeline to compare with examination, blood chemistry, glucose, electrolytes, and urinalysis. Let's move to Chapter 6 and a tiered response. Tier 1 fits a single explainable increase in an otherwise normal dog after exercise, heat, or a switch from moist to dry food. Provide a cool area, unrestricted plain water, and quiet observation for 24 hours. Do not force water or add salt, sugar, or human hydration mixtures. If thirst does not return to baseline, move up the plan. Tier 2 is measurement for a bright, eating dog with comfortable urination and no emergency sign, but recurring thirst. Measure for 2 to 3 days, but call sooner if intake approaches or exceeds 100 milliliters per kilogram per day. Keep the usual diet consistent and avoid unusually salty treats. Monitoring shows severity. It does not treat the cause. Tier 3 is prompt veterinary evaluation for persistent thirst, a major baseline change or any warning cluster. Report milliliters per kilogram per day, duration, urine pattern, appetite, weight, reproductive status, recent heat cycle, and medications. Examination, urinalysis, and blood tests can assess glucose, kidney and liver markers, electrolytes, and calcium. Results may lead to culture, blood pressure, imaging, or hormone tests. Never stop steroids, seizure medicine, diuretics, or other prescriptions yourself. Sudden withdrawal or uncontrolled disease can be dangerous. Tier 4 is supportive preparation, not a cure. Keep clean water in stable bowls, offer frequent bathroom trips, use washable bedding, and keep activity gentle if your dog tires. Feed the usual diet unless directed otherwise. If the clinic requests urine, follow its collection and timing instructions. A home sample cannot replace a sterile culture sample. This protects comfort and information. It does not reverse diabetes, kidney disease, Cushing's syndrome, infection, pyometra, liver disease, hypercalcemia, or diabetes insipidus. Here is my favorite low-cost trick. Make a water ledger with a marked refill container. Each morning, fill a clean container and replenish the dog's bowls only from it. Record spills. At the same time next morning, subtract water left in the container and bowls from the starting amount. A phone photo of the scale creates a time-stamped record. The safety rule is absolute. This container measures intake. It is not an allowance. If it empties, refill it immediately and record the extra water. Now we reach the boundary where home care stops and the vet visit is mandatory. Seek emergency care if your dog collapses, cannot stand, is confused, has a seizure, struggles to breathe, repeatedly vomits, cannot keep water down, develops a painful or enlarging abdomen, has very pale, blue, gray, or yellow gums, or becomes profoundly weak. Go urgently for straining with little or no urine, obvious blood, or possible poison exposure. An unspayed female with thirst plus discharge, vomiting, abdominal swelling, feverish behavior, or marked lethargy needs urgent examination. A diabetic dog with vomiting, food refusal, rapid breathing, or severe weakness may have a metabolic emergency. Do not make internet-guided dose changes. Without emergency signs, arrange a prompt appointment if thirst lasts 24 to 48 hours, repeatedly returns, exceeds about 100 milliliters per kilogram per day, or accompanies any warning sign. A veterinarian can measure urine concentration, test for glucose, protein, blood, inflammation, and infection, and interpret this with blood work. Imaging may assess kidneys, bladder, liver, adrenal glands, or uterus. Different diseases create the same bowl symptom, so guesswork can delay the right care. Let's bring it together. Drinking after heat or exercise can be normal, but sustained change means checking urine, weight, appetite, digestion, breathing, body shape, energy, urinary comfort, and, when relevant, uterine infection signs. Keep water available, measure it, and record the pattern. Home support protects comfort. It must not disguise symptoms or postpone tests. Needing blood work, urinalysis, imaging, or treatment is not failure. Recognizing that boundary is responsible, loving ownership. What first made you notice the change? The sound of drinking at night, an empty bowl, a large pale puddle, or an indoor accident? Comment with your dog's age, approximate weight, and how long it has happened, but do not wait for a reply when red flags are present. I read every single comment, and your experience may help another owner notice the pattern earlier. If this video helped you replace panic with a safe plan, like it and subscribe, then share it with someone who has recently said, "My dog is just drinking a little more." Early attention can change what happens next. I'm Dr. Ryan Scott, your neighborhood veterinarian. Stay observant, stay safe, and I'll see you in the next one.